What do I want to get out of today? I think joining together as fast track cities, the main thing is really learning from others what they're doing, sharing our passion and working out how we collaborate better. I think this network, because it is built on people who really care about the issues faced by people who are living with HIV and also to prevent HIV, I think that passion really comes out when you speak to people.
I'm very excited about the UK and Ireland Fast Track Cities Network. It is a regional focus. It provides us with a sense of attachment to colleagues that we know and have worked with in the past. Also, an approach to ending HIV and HIV stigma by the end of the decade that is really relevant for us. And so networking and connecting to this network gives us an opportunity to learn about what's being done well, what we can learn from, what initiatives we can take home and adapt for our own situation. And we don't get that in too many other forums, so it's really important that we're connecting in here.
I want to make sure that our voice is heard on a national basis, but I also want to listen to everyone else, learn from other people's experiences, learn what's being done elsewhere so that we can apply things in our own region and we can work on a national basis towards the same goals. I get really excited by being with lots of people who are passionate about the same things as me. We're all trying to achieve the same goals. We're all trying to work together. That's a major excitement for me.
I've really found today extremely moving and emotional and emotive, and people are extremely passionate and have extremely diverse views, and it's great to have all those around the table so that we can be factoring in everybody's perspectives. One thing that I really want to get out of the conference is to build some consensus about the sharing of resources, integration between clinical and non-clinical services, and more collaboration.
I was really looking forward to coming to this conference. This would be the first time I'm meeting people from other fast track cities face to face. There's tons to learn from. I know about the Birmingham context, so I was really excited to come today and just hear from other people, possibly share what we're doing too and see if there's more we can do together.
I'm quite new to the Fast Track City initiative, and so for me it's a really great opportunity to come, to meet people and to really listen to what people have done so far and how they've managed to make such amazing progress to this point. I think the really exciting thing about this network is that it's quite diverse. So there's a lot of representation outside of the kind of NHS sphere in which I work. So it's the opportunity to kind of meet people from different voluntary organisations, people with lived experience, people from funding background, epidemiological background, and it's that diversity which is really exciting.
So sometimes you can go into silos in the way that you're working. So really what I wanted today is to meet other people, to find out what the challenges are, but also more importantly, how people have overcome them. So that we can kind of learn from others and make sure we don't make the same mistakes.
Every single person is here today because they want to be here, because they care.
You could feel the energy as soon as we started talking in the room, just that kind of, we're all in it together. We all know it's really important, and just how can we take that next step and keep going.
We are going to be very bold in our approach to fast track cities in Ireland. This year, the new government has pledged in its programme for government to establish a national plan for HIV in Ireland. We have completed a scoping study around fast track cities, and we are tasked ourselves with developing, in partnership with colleagues, a fast track cities implementation plan. In terms of us being bold, being decisive, there's a lot in front of us that we can achieve. What we do need is the knowledge, the expertise, the guidance and the partnership that we can access here at Fast Track Cities UK and Ireland, and that's really key for us.
I think after today, the bold action that I'm going to take is just be really tenacious and not give in, and just really push the boundaries as much as I can, and don't be timid and don't be scared.
So there are two bold actions I'm going to take from today. One of them is there's some fantastic people I've met, and I could really do with learning more about what they're doing and how we can maybe bring their practice to ours. The second one is I think there's more that we could do within Birmingham around our policy and how we connect to support other agencies to actually look strategically at how we can embed some of the things we're trying to do. I've been really inspired by what others are doing in this area, and I think I'm going to go and do something about it in Birmingham.
My priority is thinking about how we can widen what we do within Brighton and Hove to look at our neighbours and the wider network, thinking about the boundary that's set and how people don't live really within those boundaries, and how we can share some of our experience with some of our colleagues who are in wider Sussex and who perhaps don't have the same level of resource and support as we do.
And I think just to continue to have courageous conversations and to say the thing that you're afraid to say, but that you've really been feeling passionate about within this sort of work, if we don't do that and we don't come from a position of like honesty, authenticity and accountability, those goals are not going to be met.
One of the things that I've learned today is to keep going, to be tenacious, to not take no as an answer, and to use those relationships and interconnectedness to be able to get to where we need to be.